EHR 319 Sensory Motor Integration and Rehabilitation. Assessment 2 Neurological Condition PowerPoint Presentation by Wesley Goldspink, student number 114497773. Parkinson's disease is an age-related neurodegenerative disorder. Parkinson's primarily affects the elderly and typically affects 0.1% of the population and 1% of people over 75 years. Due to the world's aging population, it has been estimated by the year 2020 there will be approximately 40 million suffering from this progressive neurological condition on a global scale. Parkinson's has a detrimental effect on motor control. Motor control can be defined as how our neuromuscular system functions to activate and coordinate the muscle and limbs involved in performance of a motor skill. Therefore, Parkinson's disease leads to problems when attempting to perform skilled motor tasks, including walking, writing, and speaking. This paper aims to discuss the pathophysiology in detail and the effects Parkinson's disease has on movement and daily living. Conversely, the paper will finish with the research-based benefits of exercise and recommendations of exercise protocols that are effective in treating the symptoms of Parkinson's. Pathophysiology. Parkinson's disease is characterized by both physical and psychological symptoms such as decreased motor control, postural abnormalities, through to the chronic depression and apathy. The neurological disease, which is Parkinson's disease, has been attributed to the function of the basal ganglia, which is caused by the accumulation of a protein called alpha-synuclein into inclusions called Lewy bodies in the neurons, which contributes to the low production of the neurotransmitter dopamine by the substantia nigra. In the brain, dopamine functions as a neurotransmitter, a chemical released by nerve cells to send signals to other nerve cells. The disease is caused by the slow deterioration of the nerve cells in the brain, which create dopamine. Dopamine is a natural substance found in the brain that helps control muscle movements throughout the body. The basal ganglia are focused predominantly on the arrangement of particular motor programs which translate into smooth movements. They are associated with a variety of other functions including voluntary motor control, procedural learning, and routine behaviors. The structural components of the brain that are most directly involved in the control of movement are the cerebellum, cerebrum, and brainstem. The cerebellum consists of two halves, known as the right and left cerebral hemispheres. As the cerebrum directs conscious and voluntary movements of the body, the lack of movement experienced is caused by this part of the brain, and the functions of the primary motor cortex, premotor area, supplementary motor area, and the parietal lobe, as well as the structural components of the brain. It is vital for the implementation of smooth and precise movements. The cerebellum is situated posterior to the cerebral hemispheres and is connected to the brainstem. In its role, the cerebellum functions in error detection and correction. It coordinates movements and postural control by comparing actual motor output with the intended movement and then adjusting the movement as necessary. It is involved in learning, timing, and rhythm of movements, synchronization of movements, and learning to correct motor errors. The brainstem is located directly under the cerebral hemispheres and connected to the spinal cord. The brainstem allows nerve connections from both the motor and sensory systems pass from the brain to the rest of the body. This includes the cortospinal tract, motor, the posterior column medullary lemniscus pathway, which is fine touch, vibration, sensation, and proprioception, and the spinothalamic tract, which is pain, temperature, itch, and crude touch. Secondary symptoms when these anatomical features are disturbed by Parkinson's: difficulty showing facial expression such as smiling or frowning, handwriting may become small and cramped, speech may become slow, whispery, or slurred, trouble chewing or swallowing, difficulty with fine movements such as tying shoelaces or buttoning shirts, loss of bowel and bladder control, cognitive problems, like hallucination or loss of intellectual capacity. Effects on movement control. McCain's derived a progression of the symptoms over 5 stages. Stage 1. Unilateral movement, where one limb may begin experiencing the effects of the disease. Bilateral movement, where both sides of the body start experiencing the effects. Stage 3 involves slowing of movements, postural instability, and interference in gait. Stage 4 involves increased postural instability as well as rigidity and bradykinesia becoming present. Stage 5 has the patient confined to a wheelchair due to the inability to walk caused by bradykinesia and rigidity. From stage 1 through to 5, decreasing dopamine and nigral neurons are the cause of increasing severity of symptoms. The early stages of the disease is characterized by 4 symptoms, including slow movements, tremors, muscle rigidity, and postural instability. In a more advanced stage, thinking and behavioural problems may arise, including dementia. Slow movements are associated with difficulties along the whole course of the movement process, from planning to initiation and final execution of the movement. It also causes problems with performing daily tasks which require fine motor control. The cause of this stiffness is an overactive subthalamic nucleus, which as a result inhibit the motor thalamus and motor cortex. Tremors are the most apparent and well-known symptom. They usually occur in the most distal segments of the body, starting in one limb and becoming bilateral with disease progression. Rigidity is the stiffness or resistance of a limb to move, commonly caused extreme constant muscle contractions, reducing the body's ability to move. Postural instability is more common in the later stages of the disease and leads to impaired balance and frequent falls. Individuals suffering from Parkinson's disease experience deficiencies in maintaining equilibrium due to both static and dynamic movement. This lack of equilibrium causes irregular gait due to the interface caused by decreased dopamine in the brain. This can vary depending on the individual and their age. Finally, the last section of the brain that can be affected by Parkinson's disease is the parietal lobe, which is involved in the voluntary control of movement. The parietal lobe is the integration of movement preparation and the execution processes by interacting with the premotor cortex, primary motor cortex, and the supplementary motor. The symptoms of Parkinson's disease vary considerably amongst patients. Their specificity and onset of movement disorders can be very different in motor performance over a distinct period of time. Treatment and interventions. Modern treatments are effective at managing the early motor symptoms of Parkinson's disease. This can be done through many different ways. The use of drugs, multidisciplinary support, or neurosurgery. Drugs. This is mainly through the use of dopamine agonists. As the disease progresses and these dopamine neurons continue to be lost, these drugs eventually become ineffective at treating the symptoms. The main aim of the drug to treat for Parkinson's are: increase the level of dopamine that reaches the brain, stimulate the parts of the brain where dopamine works, and block the action of other chemicals that affect dopamine. Early access to a multidisciplinary support team is important. These teams may include doctors, physiotherapists, occupational therapists, speech therapists, dietitians, social workers, and special nurses. Members of the teams assess the person with Parkinson's and identify any potential difficulties. For example, physiotherapist programs are designed to increase the quality of life for the patient by making the diminishing effects of Parkinson's disease slightly more controllable and slowing down the rate of deterioration, so general functionality of everyday tasks can be completed with ease and precision. Neurosurgery or brain surgery is an option to treat Parkinson's symptoms, but it is not suitable for everyone. There are strict criteria and guidelines on who can be a candidate for surgery, and this is something that only your doctor can decide. The 3 most common forms of surgery for Parkinson's disease are phallotomy. The surgeon makes a lesion on part of the brain to alleviate some forms of tremors. Pallidotomy. The surgeon makes a lesion on a different part of the brain to alleviate wriggling movements. And finally, deep brain stimulation. The surgeon places an electric deep brain stimulator in the brain to control specific symptoms. The electrical impulse creates a lesion which blocks abnormal nerve signals and reduces the target symptoms. This device is sometimes called a brain pacemaker. Deep brain stimulation involves the implantation of a pulsar generator which can be used to deliver high-frequency stimulation to the sensory motor portions of the subthalamic nucleus or the globulus pallidus via the use of electrodes. Exercise management programs for individuals with Parkinson's disease aim to combat the symptoms of Parkinson's that inhibit and decrease quality of life. As described earlier, Parkinson's disease decreases the ability to complete simple activities of daily living, such as walking, reaching, and grasping items. Evidence suggests that regular exercise can improve some symptoms of Parkinson's disease and improve your quality of life. You should consult closely with your doctor, physiotherapist, or healthcare professional when devising your own exercise program. Treadmill training involves several sessions daily, up to 4, which are believed to provide an external cues for the participant. Neural mechanisms behind the improvements are debated, such as sensory motor or visual cues, although follow-up research has deemed treadmill training as effective. Benefits of regular exercise for a person with Parkinson's disease can include better control over gross motor movements, such as walking, greater muscle strength and flexibility, increased cardiovascular fitness, improved coordination and balance, improved posture, reduced muscle cramping, greater confidence in performing daily activities, reduced stress levels, and improved joint mobility. General recommendations on getting started include aim for at least 15 minutes of exercise a day, include a thorough stretching program that targets each joint and muscle group, spend a few minutes warming up and cooling down, start with the easiest exercise first, slowly introducing the more difficult exercises as the fitness increases. Try to perform each movement to the best of your ability. Stop and rest if you feel tired at any point. Stop doing any exercise that causes you pain. If you suffer from fatigue, try exercising earlier in the day, and try to make exercise fun. If you are at risk of falling or freezing, general safety suggestions include do your exercises sitting down, hold onto a chair when doing standing exercises, don't do floor exercise if you can't get yourself up, only exercise when other people are home that can help if necessary, and exercise with others. Ask for assistance. Parkinson's can cause considerable difficulties in a person's ability to communicate with others. It can affect people in different ways. These problems, however, can be overcome by understanding the complexities of the illness. Research has shown regular exercise of everyday movements provides enough neurostimulation to reduce the degenerative effects of this disease. This paper discussed the pathophysiology in detail, highlighting the main symptoms that makes this neurological disease so horrifying and frustrating for the victim. Conversely, effects those symptoms have on movement control in terms of restriction, involuntary tremors, and effects on daily living were discussed. Neuromechanisms that cause Parkinson's disease have been highlighted, allowing a deeper knowledge of the underlying factors that need to be addressed in terms of dopamine deficiencies and ineffective basal ganglia. As more research is committed to Parkinson's disease and interventions that treat the debilitating symptoms that affects the daily living of its victims, step-by-step treatments are becoming more effective and knowledge on the disease is increasing. This can be seen by the recent research on benefits of treadmill as an intervention. With promising results, the battle against Parkinson's disease is looking hopeful.